Let's talk about the topography of the kidney. So the kidney is located in the retroperitoneal space between the 12 thoracic vertebrae to lumbar three vertebrae. The kidney has anterior surface, the kidney has posterior surface, the kidney has lateral border or margin, and kidney has medial border or margin. So at this medial border, we see the hilum of the kidney. The hilum of the kidney is an entrance in which structures pass inside and out. Structures enters into the kidney or leave the kidney, and it is located at the intervertebral disc between the lumbar 1 vertebrae to lumbar 2 vertebrae. That is where the hilum of the kidney is being projected. And at the left kidney, we notice that the hilum of the left kidney is 5 centimeters away from the midline. So if we measure from here to this side at the left kidney, we notice it has 5 centimeters away from the midline. And the kidney also has what we call the superior pole and the medial superior pole, the inferior pole. So the superior pole of the right kidney is kind of downward due to downward displacement of the liver occupying this position, unlike the right kidney that is being accommodated by the offset of the stomach. So let's talk about the poles of the kidney. So this superior pole of the kidney is 2.5 cm closer to the midline, while the inferior pole, the two inferior pole of the kidney, is 7 cm away from the midline. And let's talk about the relation of the kidney. So the relation of the kidney, well, let's focus on the anterior surface of the kidney and the posterior surface of the kidney. So while looking at the anterior surface of the kidney, let's look at the things that are more related or close to the kidney. At the superior pole of the right kidney, we can see there is a gland here called the suprarenal gland, and the superior 1/3 of the anterior surface of the kidney around this side is where we have the peritoneum called the hepatorenal pouch of Morinsen. And at the center of the anterior surface of the right kidney, that's where we can feel the descending part of the duodenum. And at the lateral part of the inferior pole, somewhere here, that is where we notice the right colic flexure. And at this medial inferior pole of the anterior surface is where we see the ileum of the kidney. So let's look at the relation at the left kidney anterior surface. So at the anterior surface of the left kidney, superior pole of it is the suprarenal gland that occupy the superior pole. Inferior to the superior pole, laterally, like this, lateral is in contact with the spleen, and medially it is in close proximity to the stomach. And the lateral part of it, and the inferior half of the anterior surface, at this edge here, is close. Is where we feel the left colic flexure. At the medial surface of the posterior pole, anteriorly, is where we have a peritoneum of the jejunum. Okay, so at the posterior relation of the kidney, is mainly by neurovascular structures and muscles, which these muscles are the psoas major, quadratus lumborum muscle, the diaphragm muscle, and the transversus abdominis muscle. The neurovascular structures that we can see here, the nerves that are present here are the iliohypogastric nerve and the ilioinguinal nerve. They lies at both posterior relations are the same. So this bound the posterior surface of the kidney.